Hello, this is Patrick McLaughlin, Chief of Strategic Planning for Albemarle County Public Schools. I'm speaking with you today to give you some updates about our return to school plan. On November 9th, Albemarle County Public Schools entered Stage 3 of our return to school plan. We are pleased to have our youngest learners back in our buildings for hybrid learning, as well as additional secondary students for in-person access. With reports of increasing COVID-19 infections across our state and the country, I'd like to share with you the factors that will help us determine whether it is safe to continue with face-to-face instruction. Please remember that no decision has been made about the return to Stage 1, and we send this information out as a service to the community to keep you informed of our decision-making process. As we consider our staged approach in our return to school plan, it's important to remember that stages present a sequenced approach to return from fully virtual instruction to fully in-person instruction. Public health data will guide the decisions that the school board will make regarding the return to school plan, and Albemarle County schools will need to be fluid in order to respond to the needs of the community and to public health guidance. The Centers for Disease Control and Prevention published indicators for dynamic school decision-making to help communities better understand the risk of introduction and transmission of COVID-19 in schools. The guidance includes 3 core indicators of disease transmission: the number of new cases per 100,000 persons within the last 14 days, the percentage of RT-PCR tests, molecular diagnostic tests, that are positive during the last 14 days, and the ability of the school to implement 5 key mitigation strategies, which include the use of masks, social distancing, hand hygiene and respiratory etiquette, cleaning and disinfection protocols, and contact tracing in collaboration with the local health department. The Virginia Department of Health tracks these metrics daily and makes them accessible to the public on their school metrics webpage. You can view the COVID-19 pandemic metrics for ACPS by selecting Albemarle in the Select Locality drop-down menu. The following metrics would prompt Albemarle County schools to shift to Stage 1. If for 7 consecutive days in Albemarle County, the number of new cases per 100,000 persons within the last 14 days exceeds 200, and the percent positive of our diagnostic tests exceeds 8%, ACPS will shift to Stage 1 of our return to school plan, which is virtual instruction for all students. In this scenario, a shift to Stage 1 would not require school board approval. If such a move became necessary, we would notify school board members, employees, and families immediately, and the transition would occur at the beginning of the following week. Additionally, beyond our locality's COVID-19 pandemic metrics, other factors such as higher absentee rates of students and staff or evidence of spread in our facilities could result in a return to Stage 1, even if thresholds have not been reached. Thresholds are intended for division-wide decisions. Short-term decisions made by individual schools may occur separately if circumstances warrant and in consultation with the local health department. Should the division move to Stage 1, it would remain in that stage as long as the 2 health measures exceeded the thresholds described above. When the 2 measures decrease and are on track to fall below the benchmarks, the division will announce a return to Stage 3. Stage 3 will begin when there is a downward trend of both CDC indicators for 14 days and at least 1 measure is below the threshold. The Virginia Department of Health has created the following graphic that combines information from the health agencies with the phased reopening approach developed by the Virginia Department of Education. It crosswalks the 5 categories of risk of community transmission from the CDC with the Department of Education phase guidance. As you can see on this graphic, schools can reopen in DOE Phase 3 at the lowest levels or lower levels of risk, can reopen in DOE Phase 2 at moderate or high risk, and at DOE Phase 1 when the highest level of risk of community transmission. As a reminder, our recommendation for ACPS Stage 3 aligns with the DOE Phase 2 guidelines. As demonstrated this fall, cases at the University of Virginia affect our data, but there has been no evidence of community spread from the university to the greater community. The current public health and safety thresholds will remain in place while UVA is not in session between now and February 1st. Once UVA students return for the spring session, the impact will be analyzed when considering these thresholds. Thresholds must take into account the circumstances that could influence our data, but pose no risk to our schools. For example, a large outbreak at a long-term care facility may result in data exceeding a benchmark, but it would not require the school division to return to Stage 1. In a shift to Stage 1, the majority of students would remain with the teacher to whom they are assigned in our current Stage 3. If schools need to change individual student assignments to provide more equal opportunities and access to instruction, principals will reach out to parents and guardians to consult on this change. In Stage 1, school buildings will remain open to staff for use in virtual instruction and for the preparation of student meals, which would continue to be delivered along bus routes. For additional information about our planning, please visit our Return to School webpage and review our frequently asked questions. Please always feel free to contact your child's school with any questions specific to your family. And as always, we encourage you to contact us with any questions or feedback.